presentation, everyone. We have a stand-in for Jody DeShore. We have Sargent Goodchild, who's going to be sharing with you some very important information and his personal story. So will you please welcome him?
Thank you very, ooh, this is loud. I'm gonna startle myself. Maybe I need to check my own moro here. So, first of all, I want to say thank you to everyone who's put together such a great event. This is my second time here, and every time I come, I feel like not only am I among my tribe, but I learn so much each time I come. So thank you for having me, and thank you for giving me the opportunity to get up here today. So my name's Sarge Goodchild, and I have a practice just north of Boston called Active Healing. I began working with kids about 23 years ago, primarily kids who had autism and vaccine injury. I also see a lot of kids with other disorders, with learning disabilities, things like cerebral palsy, epilepsy, and over the last 10 or 12 or 15 years, I've been seeing a lot of kids who have institutionalized trauma, kids who have been adopted from third world orphanages where they've been neglected and abused and given their care on a schedule basis rather than on a needed basis, and have been tied to their cribs, et cetera. This is one of my first clients, and it may be hard for you folks to see, but the way he's holding that codfish is awkward. That earned him the diagnosis of mild cerebral palsy. But if you look at his eyes, is there anything that looks funny about his eyes? Anyone? Looks like Down syndrome? What else? I'm sorry, what? They're both swollen, but particularly the right eye. How about his mouth? Anything look funny about his mouth? Gaping. What else? The bite's off, but it's more than that. He's got a pretty big, broad smile, wouldn't you say? Yeah, what's missing? Teeth. The kid has no teeth. He has teeth, but he's on so many seizure medications that his eyes are nearly swollen shut, and his gums are so engorged that his teeth can't come through them. So the solution wasn't to reduce his seizure medications. The solution was to take this child into the dentist every few months, take a surgical blade out, and cut his gums back without anesthesia, because he was on so many anticonvulsants that if you'd given him an extra medication, you would have slipped him into a medically induced coma. This child's appropriate educational setting was in the back of a classroom in a study carrel. So if you've been to a library, you've probably sat in a study carrel. It's the desk with 3 walls. Couldn't see the teacher, couldn't see his classmates, and didn't get much learning done. So he was considered mentally retarded, uneducable. He had the worst case of epilepsy that many doctors at Boston Children's Hospital had ever seen in their careers. His mother was told that he had autism, but this was back when autism was 1 in like 8,000, not 1 in 65. His father was told that he had Huntington's chorea, and he wouldn't live past the age of 8. When he lived past the age of 8, he wouldn't live past the age of 12, etc. And I put that slide up there because I don't know how many people have ever heard of Les Brown. He's a great motivational speaker. His nickname, Les Brown's nickname as a kid was DT, which stood for dumb twin. Les Brown's now a multi-millionaire, I would imagine. Les Brown says that no one's opinion of you has to become your reality. And I think that's something that's really important. No one's opinion of you has to determine your future. It doesn't matter what doctor, what person, what educator you're talking to. If you're diagnosed with mild cerebral palsy, with autism, with Huntington's chorea, with severe epilepsy, people are putting a limit on you. They're putting a glass ceiling over your head. And their thinking may be limited, but yours doesn't have to be. So, that kid, of course, was me. So, no one that I met from a medical standpoint between the time I was born until I was 13 years old saw someone who is going to go, and I've ridden my bike across the United States twice. I've lived in Madrid. I've done Peace Corps type work in the Dominican Republic and Puerto Rico. I've got a family. This is hard to do in front of a group. It's been a while. So,
You're doing awesome.
I have an amazing family and a great business, and I enjoy life every day. And what got me here was bioregulatory medicine before bioregulatory medicine existed. So, the mind's first step to self-awareness is through the body. The body is a vehicle that allows the brain to go out, experience the world, and grow and mature as a result of that experience. We can talk about something called the function structure loop. It's been brought up a couple of times in presentations already that have occurred. What I do at Active Healing is I capitalize on that function structure loop on the functional side using developmentally appropriate functional movements to not only assess the health of different areas of the brain, but to then bring health to those weak areas of the brain. I think it's really important that as a group, we begin to understand that when we see a kid who's walking in, or an adult who's walking into the room, and they're presenting with any number of health challenges, but especially anxiety type of stuff, neurological stuff, and we see that there's something odd about the way they move through the space, movement, the movement disorder that you're seeing is not separate and distinct from the challenges that that person is walking into the room with. Movement disorders are often central to the challenges that that person is walking into the room with. And we can't turn a blind eye to that and try to treat everything else without treating the movement disorder at the same time. This is probably hard for you guys to see. If anyone wants one of these, you can simply drop me an email and I can get a PDF of it off to you folks in a reply email. But this is called the ontogeny of human neurological functions. The ontogeny of human neurological functions sets out that 20% of what we do from the time that we are born for the first 6 or 7 years of life that contribute to 80% of our neurological growth. So we're taking Pareto's law of economics, which says that 20% of what we do leads to 80% of our growth, and we're applying it on a neurological level. So 80% of what a kid does is pick their nose and throw their food and mess up their room and whatever, and that contributes somewhat to their neurological growth and development. But 20% of what a child does is crawling around on the floor, learning how to use a sophisticated cross-lateral pattern in a 2-beat rhythm, learning how to creep on hands and knees in that same cross-lateral pattern with a 2-beat rhythm. They learn how to hop, they learn how to skip, they learn how to jump. And those skills, those skills that the child is doing at that time are challenging the brain, challenging the body, challenging the brain, and encouraging enormous amounts of neurological maturity from that child. So we can look at all these different things. I also use this as my measuring stick, right? So every time a child comes into the office, I quantify where they are on this chart. So these are the functions that allow me to do, in really quick order, I can do a neuropsych on a kid that is in 3 minutes. I can do a neuropsych on a kid that is as accurate as any neuropsychology test that you'll get. With, on the positive side, I'm going to give you really structured things that you can do to change that profile, instead of telling you that the child needs preferential seating in the classroom, which is the big result from a lot of expensive neuropsych testing. So we want to create a diagnostic trail of evidence, right? So we want to look at, so I'll break these 6 levels apart. They're vision, hearing, sense of touch, mobility, language, and hand function. And there are aspects of all 6 of those different pathways that are controlled by different levels of the brain. So we can look at mobility, right? And we hope that when the child is born, they have a full range of motion in all their extremities, including the neck. If they don't, we're gonna not have an organized developmental process unfold, right? If we have something off in the hips or something off in the neck or anywhere in the spine for that matter, then the child's not going to be able to use their arms and legs correctly, and that's going to prevent them from learning how to crawl on their stomachs correctly, and that's going to pervert the rest of their development. And because those functions are so critical, it's also going to have a huge outsized impact on how well their nervous systems organize themselves. So, but it could just be, right, when I'm looking at a 15-year-old and I ask that 15-year-old to get down on the floor and crawl for me on his stomach again, I can be seeing a whole bunch of different things. I can be seeing a 15-year-old who got badly beaten up in the lacrosse game last night, right, and whacked his knee, so now he can't use his right leg. And it wouldn't be appropriate for me to assign his particular crawling technique to a neurological deficit, right? We could have a structural deficit. But if I put that 15-year-old down on the floor and I ask him to crawl on his stomach, And I see that he doesn't do that very well. But I also question the mom and the dad, and I find out that he has a really high pain tolerance or a really low pain tolerance, or I can go like this to him, and he wants to run through my plate glass window at the front of the office, but if I come up to him and give him a giant, strong bear hug, he's melting into my arms. Well, all your sensory integration stuff, from my experience, directly correlates to the Pons. So if I start building evidence of multiple different pathways that are all pointing to the Pons, then it's probably not that he can't crawl, it's probably that the Pons isn't organized enough to allow him to crawl in an organized manner. Is this making sense? So we're creating a diagnostic trail of evidence. So I use this chart, and from this chart, I can see which areas of the brain are strong, which areas of the brain still need to be sophisticated, are weak. And then what I do is I train the parents how to facilitate the very specific developmental movements that are needed to challenge that area of the brain and bring some maturity to it. And the results can be huge, right? We can take a kid who is drooling all over his paperwork in the back of the classroom in an individual study carrel where he couldn't see his class, the teacher, or anything else, and that kid can go off to ride his bike twice across the country, he can sail boats offshore, he can live overseas, he can graduate from college, he can go on to have a family, a business, and there is nothing unique about me that allowed those things to happen outside of the fact that I was fortunate enough that my mom and dad met a good physical therapist. That physical therapist looked at my parents and said, "Your kid's brain injured, and you're only treating the symptoms. And you're never going to heal this kid until you get at the root cause, and that's his brain." So by taking myself through, or by being taken through this program, what occurred was I began to find homeostasis for the first time in my life. I began to find balance. And while it was never done on me specifically, I mean, I had tons of EEGs, but I never did a pre and post program EEG. But I've talked with medical doctors since, opening up active healing, who in particular were medical students who had volunteered as assistants to help take a child like myself through these dynamic ranges of motion, which is what we use to teach healthy patterns, healthy movement patterns. And because they were medical students, they did pre and post these movement EEGs, and what they found was that when you took a kid through these very dynamic ranges of motion, where you coordinate the arms and legs with what the head is doing, that you went from these totally disorganized EEGs to absolutely typical healthy EEG patterns in a matter of minutes. I was fortunate enough a few years ago to do some, I had a woman come in and do some quantitative EEGs in my office. I had 3 kids that I was going to be taking through intensive neurological reorganization, which means 15 hours in a week. So I was doing 3 hours a day for 5 days with these kids. We decided to do quantitative EEGs on Monday before they got any treatment with me. They only ended up getting 11 hours of exercises with me, crawling and creeping and vestibular stimulation, and I do something called hypercapnia. And then at the end of that on Friday, we did post-quantitative EEGs with them, and we got very significant results. We could only test 2 of the kids. The 3rd kid was so hyperactive that we couldn't keep the EEGs on him. So we had to throw out his stuff, but remarkable progress. So Love Einstein. Who doesn't love Einstein, right? Nothing happens until something moves. And then how it moves determines what happens. Right? Function determines structure. If your function is to sit in front of a television, spectate your sports while eating potato chips and drinking Budweiser, what's your structure going to look like? Right? If your function is to eat kale and do yoga, you're going to have a totally different structure, right? You can't break that link, but we typically don't look at the neurological side of things. So the picture that you saw, that's my son, more or less, in the last year. That's my son in the top right there, at the age of whatever, 3 or whatever he was. He would hate that picture being up right now. But he's on the floor and very happily engaging Dad in demonstrating what good crawling looks like. So we can see a whole bunch of things. We can see that his right hand is coming in under his chest, and it's about to rotate, flip, and come out. So doesn't seem like a big deal, but that ability to do this leads to every single manual skill that follows. And one of the really easy things to do to test for how someone's cerebellum is functioning is to have them do this, right? And then flip it over. And you will see all sorts of people who are like, and so we've got kids who have really poor manual skills, and when you ask them to do this, they can't do it. And it's because that hand has not come in and under. If we were to flip him around and look at his feet, we'd see that his heel was up in the air, which was facilitating a really strong toe dig. And then he's going to push off with that leg. He's going to arch the bottoms of his feet. He's going to stretch the heel cord from where it attaches back here to behind the knee. He's going to wear hip sockets. He's developing the secondary curves in his spine. He is stimulating the most tactilely sensitive areas of his body. He's hooking up his vision for the first time. He's looking a little bit to the right, a little bit to the left, a little bit to the right. So he's learning how to track across the horizontal plane in a unified way with the eyes teaming together. I think there's a lot going on in hearing because of what's developing in the structure of the neck. My hypothesis anyways. There's just an enormous amount that's taking place for this child. And if he doesn't do that correctly, what really suffers is his pons. So the pons is the little part of the brain that sits right behind the eyes, and it's responsible for all your sensory integration disorder. So when you have a kid with sensory integration disorder, you're also going to have a kid with tight heel cords, who doesn't have good arched feet, whose spine's out of alignment, right? And we can go back and we can correct all those things. And we should go back and we should correct all those things to the best of our ability. But nothing makes up for the missed developmental experience except for going through the process to sophistication. So that's what we want to do. The Pons, which is associated with belly crawling, the Pons is responsible for making the world feel like a safe place in which you belong. The Pons makes you feel like you belong in your family. It makes you feel like you belong in the classroom, like you belong in the school building, like you belong in your community. The Pons gives you a healthy sense of sensory integration. So you have an appropriate awareness of pain, temperature, and discomfort. The Pons signals the production of serotonin, as I understand it. There might be people in here who are much more knowledgeable than me on that, but when we have a disorganized Pons, because that level of mobility has not become sophisticated, we get a kid who, we have 2 kids walking, they're playing on their technology and they're walking down the hallway of their school building and they bump shoulders. The kid with the organized Pons is going to go, oh, dude, my bad, I'm sorry. The kid with the unorganized Pons is going to go, what the hell, man, you did that on purpose. And he's going to be all bent out of shape because the world, he wakes up every day to a world that is hostile. And that's going to continue to be the case until we go back and we fix what's wrong in the Pons. So that's not my son in the lower picture there in the diaper. But that is a good picture of a child doing a really sophisticated creep pattern. So we can see that we've got the left arm and the right leg advancing together. We can see that his fingers are straight ahead, the feet are dragging on the floor, the head is upright. We don't know what rhythm he's using because it's just a picture, but it looks like it's probably going to be a pretty sophisticated rhythm as well. That's what we want to see for the kids. So we build up so much proprioception through the earlier act of crawling on our belly that we develop the ability to resist gravity for the first time in our life. At the same time that a reflex called the symmetric tonic neck reflex comes aboard and forces us into that secondary position up on hands and knees. Now, when we do that, generally most kids will start rocking back and forth, like from cat sit to all fours and back and forth again, which is integrating, among other things, that symmetric tonic neck reflex. When the child starts doing this, he starts organizing all the structures of the midbrain. And as you organize the structures of the midbrain, you start to cut off some of the peaks and fill in some of the valleys on an emotional level. The midbrain is responsible for storing information in a really organized kind of Dewey Decimal kind of a way, so that even when we're under stress, we can go back and we can find that information with relative ease and pull it out. But when the midbrain is disorganized, our ability to do that is significantly hampered. So all the information is going in. All the information is there. The brain's taking it all in. But if we don't have an efficient system at filing it, then when we're under stress, we can't pull that information back out. And these are the kids who fail in like testing situations. Kids who have trouble with creeping tend to be the kids who are diagnosed with hyperactivity in the classroom, and real hyperactivity, not anxiety that's masquerading as hyperactivity, because there's a ton of that out there too. But kids who really truly have hyperactivity, for whatever that term is worth, usually have trouble in the creeping stage of their development. And they've often got a retained symmetric tonic neck reflex, among other things, which makes it really difficult for them to keep their arms, their elbows, and their knees bent simultaneously. So sitting in a chair at school becomes, how many people in here are old enough to remember Mork and Mindy? Okay, so Mork used to come into the set, and he'd flip upside down and he'd sit on his head on the couch. Do you guys all remember that? Okay, now who thinks that they could learn trigonometry like that? Nobody, right? Because you're putting so much effort and energy into maintaining proper posture, you've got nothing left over from an intellectual perspective. And when we ask kids with the symmetric tonic neck reflex or a spinal galant reflex or a disorganized midbrain to maintain proper posture in a chair, they're taking all of that should be going into their intellectual pursuits and putting in a proper posture. These are kids who will often do much better standing at the dinner table. Like if you've got the kid at home who drops the fork on the floor, takes it to the sink, gets another fork, comes back from the table, spills his milk, gets up, goes, gets more milk, realizes he's missing a Lego piece because he's also making Legos and he's just up and down and up and down and up and down. You've got a kid with a symmetric tonic neck reflex. 95% chance. And if you let that kid just stand at the table, he'd do much better. And kids become two-dimensional at this level too, I'll mention that. When a child is on the floor and crawling, most of their what we'll call language, most of their communication is directed inward. You know, like I need a diaper change, or I need food, or I just fell and I need someone to soothe me. It's all inbound. When they get up on hands and knees, they actually enter the second plane and they become more interactive. So it's a fun time of parenting. So you can see how his right heel is kind of up in the air and how he's planting that right toe on the floor. And you can see how his left hand is underneath his chest, and you can see the camera caught him in an awkward moment here, so he looks like he's in a homolateral pattern. There's just a bigger picture. So what we're talking about here are the opportunities that healthy developmental movement provide us. And almost all opportunities are disguised as hard work, right? And this is very hard work. And it's harder when you're taking a child back. It's harder when you're taking a child back at the age of 8 or 10 or 12 or 16 years old to get them on the floor and to do this. But the benefits of it are enormous. So I didn't start a program until I was 9 years old. And I was clearly really struggling. So my parents took me out of school for a year, and I was fortunate to have a fairly large bedroom. And we put some gym mats down on the floor. We put an overhead brachiating, what we call monkey bars, what you guys call monkey bars, what I call brachiating ladder. So I had a brachiating ladder in my room. I had, from that ladder, a place to hang upside down by my feet. So my mother would tie straps around my ankles and clip me in, and I would hang upside down from my feet. I learned how to read hanging upside down from my feet. It was so much easier, yeah. My mother used to say that to have me sit down in front of a book and try to read was awful, but if she had me read out of a mirror, I'd do better. And so when we do something called suspended inverted rotation, hanging upside down by the feet, she would just throw cards down on the floor and they'd land every which way, and she'd be, grab the one that says dinosaur, grab the one that says alligator, grab the one that says whatever. And I would be swinging and spinning like crazy because you've got enormous freedom of movement the way that I do, hanging upside down. And that's how I learned how to read. So we'll go past here. So I've been fortunate in that the last 23 years, I've been able to take these skills that I've learned through my own process and bring them around the country. So my office is in Boston, but I have clients all over the country and elsewhere. I fly into Nashville every 4 months and see a group of families in Nashville. I see another group of families in Austin, Texas. I've got a group of families in northern Wyoming. And then I've got clients all up and down the eastern seaboard who come to my Boston office and see me there. In my Boston office, I bring in a lot of bioregulatory type of technologies to assist. Because as damaged as I was as a kid, kids today are even more damaged. And the insidious thing about it is that it's not nearly as noticeable. You can see their teeth. Their eyes don't look like they've been in a prized box fight. They're not drooling all the time and in basically a stupor. It's much deeper, and it's much harder to identify than when I was growing up. And so it takes a collection of people like the collection of people that we find in this room today to help get these kids back to where they need to be. And so I find that even though my process as a child didn't involve anything outside of neurological reorganization. I did not benefit from chiropractic or acupuncture or a naturopathic doctor. In 1978, when I was going through this, Bernard Rimland, I don't know how many people know Bernard Rimland, but he was in his infancy as far as nutrition goes. So I was still eating gluten. I was waking up every morning during this process that I went through to recover and eating Life cereal, right? Odd name, but end of life cereal is maybe what we should call it. So I don't want it to take 4 years for my kids to recover. It takes 4 years or longer for some of my kids to recover. But I want recovery to go as quickly as it can, as quickly and as smoothly as it possibly can. Because I remember what it was like to get down on the floor and crawl 1,200 to 2,000 feet on my belly every day and creep 3,000 feet on my hands and knees and do countless patterns. I had 5 people who took me through patterns when I was a kid, these dynamic ranges of motion, which means one person was turning my head and another person on each arm and leg. Because I fought. We were talking about grit. I've got some grit. Technologies that I brought into the office that assist me in reaching this goal of recovery for kids includes sonic whole body vibration. By far my favorite tool that I have in my office. We use a frequency of sound. We use a frequency of sound to vibrate the plate that the person is standing on. But because it's a frequency of sound, every organ, tissue, muscle, and bone in your body has a resonant frequency. It has a frequency that it naturally is stimulated by. There is a frequency to boost, or frequencies to boost your immune system. 10 hertz is the master frequency. It's good for mitochondria. It's good for growth hormone. It's good for an enormous amount of things. We can do your adrenals at 12 hertz. I love the sphenoid bone because I think it gets the sphenoid elevated and away from the pons, and I think the pons is inflamed in so many of these kids. And I've seen situations in which you start vibrating the sphenoid bone and the kid stops having rage. Because I think the sphenoid bone is triggering the pons. The 25 to 35 hertz is great for bone density and muscle and joint repair, and that's just the tip of the iceberg. We can do so much. It's no matter what frequency you're doing, you're working the lymphatic system in a profound way. 10 minutes on this machine is an hour and a half of cardiovascular exercise without any pain, without any exhaustion at the end of it. It completely gets rid of lactic acid. And it's a strictly vertical vibration, and there is nothing mechanical in that machine at all. It is a frequency of sound, and that is it. You are standing on a speaker coil. It is an amazing machine. I do ion cleanse, detoxifying foot baths. The foot baths that I use are from a company called The Major Difference. They are very well established in the autism community because of the success that they've had. They've done 2 major studies with groups of kids with autism diagnoses. This is the shorter study with a better visual aid, which is why I chose it. So this is the 90-day study. In the 4 to 9-year-olds, so the ATEC stands for the Autism Treatment Evaluation Checklist. So the higher your score, the more severe your symptoms of autism are. Of course, the older kids get, the more toxins they've held on to, typically the more aggressive and the worse their symptoms can become, especially in their teenage years. So in your 4 to 9-year-olds, after 90 days, most of these kids were doing 3 days on and 1 day off. with regards to their foot baths. Most of their foot baths are 30 minutes long, but a bunch of their foot baths were only 20 minutes long. But in any case, at the end of the 90-day study, in your 4 to 9-year-olds, you'd seen a 43% reduction in ATEC scores. That's huge. That is enormous. In your 10 to 12-year-olds, it's 54%, and in your teenagers, it's 60%. When they extend the study to 120 days, it goes to 45%, 56%, and 64%. It is a remarkable technology. I happen to do it in really nice massaging pedicure chairs because it makes my life a lot easier. That's Jake. Jake is wearing an audio-visual entrainment machine. This is a technology that I've been using for 20 years as far as being able to put someone into a state of a parasympathetic state. I don't think there's a better way to do it. What we do is the brain has something called the frequency following effect. So when we flash a frequency of light in your eyes and it is exactly matched by a frequency of sound in your ears, within 6 to 8 minutes of that equipment being on, we can transport you to any state of consciousness that we want. Now, for a lot of people, it takes them a couple of sessions to get used to the equipment and begin to trust it enough to allow it to work, but it is phenomenal. My wife used it the night before I left to come here. I went into the room and she was snoring like a truck driver because she was wearing this. She'll literally fall asleep and wake up 8 hours later in exactly the same position using this to help her go to sleep. But we can put you in a meditative state. We can put you in a creative state. If you've got ADD, ADHD, we can put you in a focused, alert state of consciousness. We can put you anywhere on the spectrum that we want. And what's amazing about this particular equipment is it's hemisphere specific. So the right side of both eyes is controlled by the left brain, and the left side of each eye is controlled by the right brain. So using this is hemisphere specific equipment, which means whatever we're doing on the left side of each eye is being done in the left ear and vice versa. So we can actually slow down one hemisphere of the brain and elevate the other hemisphere of the brain to get rid of anxiety. It's designed by a guy named David Seaver. He originally was working in a dental lab with people who had TMJ. His whole feeling was it had a lot to do with the levels of stress that they were under. He designed this equipment. It was originally in ski masks, looked a lot funnier. And he had great results with his TMJ patients, and it's just blown up from there. His most recent study, or the one that he's most proudly touting right now, is using a program to treat diffuse axonal injury, and he has gotten unbelievable results. So diffuse axonal injuries are injuries such as concussions and closed head injuries and that sort of stuff, even strokes. So pulsed electromagnetic field, I'm not going to talk about that because I want to take some questions. I do far infrared sauna. Oh, and capable sensory products, I'll just plug them for a second. These are the best weighted blankets and similar type things that you can buy. Very well vetted. They've gotten enormous amounts of press, great press, because they were actually bought by an aerospace engineering company who did enormous amounts of testing within hospital settings and then decided they were an aerospace engineering company and they didn't want to be involved in a weighted blanket company. So the moms who own this company are phenomenal, and I always like to plug them. So that said, I'm happy to take questions. So hypercapnia is the process of elevating the carbon dioxide in the blood by 10 or 15%. And when you do that, you trigger two simultaneous reactions. One is breathing from the lower lobes of the lungs so that you're really pulling a lot of oxygen into your lungs, and then you get vasodilation to the brain, with the net result being as much as 60% more oxygen getting up into the brain. So that's the immediate benefit of doing it. When you do it multiple times throughout the day over a long period of time, you actually are you are teaching the person, the individual, to become a reflexively deep breather, as opposed to what we would do in yoga, right? What you do in yoga is very intellectualized. So when you get back in the car and you have to pick up the kids and you've got to, figure out dinner and schedules, you totally forget about your breathing. We want breathing to be reflexive, and hypercapnia is a great way to teach that. And it's unbelievable for seizures. It's great for focus and attention. It's great for a lot of different things.
How long-lasting are these treatments? Do you have to come back
Are you talking about?
or come back for maintenance?
So from a neurological reorganization standpoint, I see my clients every other month. So I'm constantly updating their programs to make sure that the programs are growing with whatever advances they're making. So I see my clients a lot, especially in the first 2 months. There's a tremendous amount of support, and then after the first 2 months are up, we move on to an every other month schedule. But I'm always available by Skype, by email, by whatever. As far as the rest of the services that I offer, the detox kind of medical spa type of stuff, it depends. I have a whole concussion routine that I run through with people, and I swear after 3 or 4 times, they're done, and they don't need to come back. My concussion stuff, I do whole body vibration, which might sound counterintuitive, but I use very high frequencies at low volumes, so I'm not jostling the brain too much. And I put them on exercise with oxygen therapy simultaneously. And from there, they finish that, and then they go into an ion cleanse foot bath with an audio-visual entrainment machine on. And I use the AVE program that is specific to diffuse axonal injury. And people will go usually 3 days, they do really well, and on the 4th day, I get a phone call saying, God, I felt great up until this morning. And I'm like, well, I told you 3 or 4 days and you'd need to come back. Why don't we have an appointment on the calendar for you? So turbosonics, I have a lot of, I do turbo, the sonic whole body vibration. I do that at least once a day, if not twice. As I said, it's my favorite technology and it's just awesome. I was out of school for a year, and then I was very slowly put back into school. It took me 4 years. Most of my clients are done in a 12 to 18 month time range. Fastest I've ever graduated anyone, like fully graduated someone from the program, is 7 months. And as I said, most kids are in my program for 12 to 18 months. It's my severe kids, the kids who have really significant autism or very significant traumas, who are with me for longer than that. How did I get off all the meds? That's a funny story, actually. So, my mother, as I started to do better, I was doing a ton of hypercapnia. I was doing a lot of hanging upside down by my ankles, an enormous amount of crawling, and enormous amount of creeping. And my mother took Bounce out of the dryer. We took Bounce out of the dryer, fabric softener, for those of you guys who are younger, and 50% of my seizures gone. Right? And so with the removal of Bounce, nothing else. Again, my mother, unbelievable smart woman. Did she change the detergent? I mean, we're talking about, I could have been done in a year and a half maybe, right? Instead of 4. No, she didn't change the detergent. She did take Bounce out of the dryer though, and that's awesome. I applaud her for that. So so took Bounce out of the dryer, doing all this other stuff. I start having a lot less seizures. So my mom starts biting little pieces of Dilantin and Mebrol and Klonopin and Valium and all that stuff that I was taking. She starts biting it, taking the little piece and spitting it into a waste can, right? Several months of this go by without my father's at work, you know, earning a living so that we can do all this at home. And months down the road, my mother's biting off the little tiny piece and throwing the big chunk into the trash can. And my father walks in the room and goes, "Martha, what the hell are you doing?" She goes, "I'm giving him his meds." And we're talking about a tiny, tiny little, like, fraction of a bit off pill that she's putting on my tongue. My father goes, "Martha, I don't think he needs it anymore." and that was how I came off meds. I think about this quite often, and I haven't come up with a solution quite yet for it, but I am really actively, over the last month, working on that. Yeah. So my time is up, but I'm around all weekend, and I'm happy to answer any questions outside of this that I can. So.